Welcome to the Stay Healthy El Paso podcast, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. This podcast is presented to you by Dr. David Midoff, expert physical therapist and owner of El Paso Manual Physical Therapy. It is our goal and intentions to provide you with valuable tips and insights from experts in the El Paso area so you too can stay healthy, fit, and energized. Now here is your host, Dr. David.
Hey there, welcome to the Stay Healthy El Paso podcast. I'm your host, Dr. David Midoff, specialist physical therapist over at El Paso Manual Physical Therapy. And today I'm going to be answering a question from a client that I got here in the clinic, brand new. She was asking, do I have sciatica or do I have piriformis syndrome? This client was just so confused about how to tell the two apart. She was worried about which one needs this kind of treatment and which one needs that kind of treatment, or who she needs to see for piriformis versus sciatica. Does she need a MRI or an X-ray? All these questions were coming up for her, and she looked me in the eye and said, which one do I have? Is it sciatica or is it piriformis syndrome? And of course we evaluated her and checked her out and we told her exactly what was going on. But I was thinking that you as podcast listeners might be interested to know how to tell the two apart in case you're suffering from this pain in the butt cheek area that is confusing to tell if it's sciatica or if it's piriformis syndrome. So today on this podcast, we're going to go into the details of it, and I'm going to give you some pointers on what to do and how to go about treating this problem so that you can kind of tell the difference between the two and know what next steps to take to fix either this sciatica problem or this piriformis problem. So first off, let's define the two just to get some clear-cut borders on what is sciatica and what is piriformis syndrome. So let's start with piriformis syndrome. Piriformis syndrome refers to the piriformis muscle, which is a muscle deep in the butt cheek area. If you pull up a picture on Google of the piriformis muscle, you'll find that right around it, above and below it, there's a bunch of other muscles. And real quick, I'll rattle them off for you. There's gemellus inferior, gemellus superior, obturator internus, obturator externus, quadratus femoris, gluteus maximus, gluteus minimus, gluteus medius, plus all the pelvic floor muscles nearby, and then of course the piriformis muscle. The reason why there isn't a gluteus medius syndrome or a obturator externus syndrome is because the piriformis just gets a bad rap. The piriformis gets blamed for a lot of pain in the butt area because of its position. It is directly over the sciatic nerve. So when people have pain in that area, then they start to blame the pressure of the piriformis muscle pushing onto the sciatic nerve. That's why these two are kind of related and it's hard to tell them apart. But let me give you two quick signs that you can check on yourself to see if it's more piriformis syndrome that you've got. Number one, pain deep in the butt area. If you can kind of poke into the butt cheek and on the side that bothers you and find a kind of a knot or a nodule, a hard spot in there that is tender, it's very likely that piriformis muscle. The piriformis muscle can become stiff and spasm, and sometimes it literally just needs to be rubbed out kind of gently to make sure that it calms down and it gets alleviated. The second sign is hip stiffness. The function of the piriformis muscle is to rotate the hip outwards. It also stabilizes the ball into the socket of the hip joint. So if you have stiffness when you first go to get up, or if you're trying to just move your leg around, say in bed or sitting in a chair or driving, and you feel like your hip that on the side that it hurts just doesn't move as good as your other hip, then that's a sign that you might have a piriformis syndrome problem as well. Now, some people might have hip arthritis, and that stiffness they may also experience hip stiffness as well. The difference between the two there is the piriformis muscle stiffness tends to free up a lot quicker than an arthritis stiffness. So if you kind of begin to move around, walk around, stretch your hip out a little bit, and then it frees up, it feels better, it's very likely that you've got piriformis syndrome. If you're going to go look into hip arthritis, then you want to get an X-ray and see how the hip joint looks and have a doctor interpret it for you so that you can know that it's more of a hip arthritis problem. Now let's talk about sciatica. Sciatica refers to the sciatic nerve. It's irritation or pain in the sciatic nerve. Now, the sciatic nerve comes out of the hip on the backside in the butt area, and it travels down the thigh, down into the back of the knee. It's down the back of the thigh, down into the back of the knee, into the lower leg, like calf area, and then it branches in a bunch of different directions, and it actually ends up going into the bottom of the foot, all the way to the tips of the toes on the bottom side of the foot. This nerve, when it gets irritated, when you have sciatica, it can also cause pain in the butt area, but it will typically radiate down into the back of the thigh. And you'll get more than just pain. You'll also get potentially numbness and tingling problems, burning sensations, aching sensations, and in more severe cases of sciatica, people will feel cramping in their hamstring area, in the calf area, even in the foot and like in the arc of the foot, and even heel pain. It could set off plantar fasciitis type symptoms too. So if you also seem to be having plantar fasciitis, like heel pain type of symptoms, then it is very much more likely that it's sciatica. The second sign that you've got a sciatica problem is if you begin to get the symptoms whenever you're standing or walking too long. Too long is relative to the individual, so it depends on you. If for some people it happens right away. As soon as they stand up and walk around a bit, they're getting their symptoms within a minute. Other people can tolerate 30 minutes to 60 minutes or more, and then they begin to get the leg pain, the back of the thigh pain, the butt pain. It may go down all the way into their calf and foot. They may even get that cramping as well. And so there you go. You've got a clear differentiation of what piriformis syndrome is and what sciatica is, and a few signs to tell the two apart. But here's the thing. Here's what's important for you to take away from this, because there's not a whole lot of treatment you can do with the information that I'm giving you. And the reality is both happen at the same time most of the time. Probably about 70-80% of the cases that I've seen, if I just give a rough estimate, have symptoms of sciatica and symptoms of piriformis syndrome happening together simultaneously. And the reason for that is because the root problems of sciatica and of piriformis syndrome are the same. So I'm going to cover with you next the three same root problems of these two syndromes, the piriformis syndrome and the sciatica problem. So the first most common root problem is a muscle imbalance, meaning the muscles on one side of the body, usually on the front of the body, are a lot stronger than the muscles on the back side of the body. And when that happens, it causes the hip joints, the lower back joints, even the knee joints to be out of balance. There's excessive pressure. There's too much pressure on one side of the joints because of the muscles being stronger on that side, and it's forcing the tissues on the other side, the muscles, the nerves, ligaments, all that stuff back there, to move inappropriately. When this happens too much over time, tissues get irritated. Certain muscles might spasm, like the piriformis. The sciatic nerve might get irritated. So you've got to look at that muscle imbalance. The second most common root cause is pelvis bones are either stuck or moving too much. So the pelvis bones, the ones that make up your hips, one might be shifted one way or another, and it could be putting some tension on the piriformis muscle, because the piriformis muscle is connected to the back of the front side of the tailbone, and then it goes out, crosses the hip joint, and attaches to the femur, the thigh bone, but it's in the pelvis area. So if the pelvis bone is shifted, it's gonna put some different stress and strain on that piriformis muscle and can cause it to want to spasm. By the same positional change, if that pelvis bone moves, it can compress the opening for the sciatic nerve where it comes out of the pelvis bone to go down the leg, and it can also cause a sciatic symptom. So the pelvic rotation could be causing both symptoms, the piriformis syndrome pain, the discomfort from the muscle spasming, as well as the nerve itself getting compressed and irritated. The third most common root cause of these two symptoms, of these two problems, is lower back issues, to put it simply, low lumbar problems. So you're talking about disc problems like disc herniations, arthritis in the lower back. Stenosis is another very common one, which is closing of the nerve openings. They're getting more narrow, and that can be causing nerve compression that causes the piriformis muscle to spasm, or that irritates the sciatic nerve as it goes down the leg as well. So those root symptoms need to be addressed in order to fix both the piriformis syndrome and the sciatica problem. If we just treat the symptoms of the piriformis syndrome or the symptoms of the sciatica problem, but not the root causes, well, it's going to keep coming back. That's why people don't ever get rid of this. In some cases, it becomes chronic, and they don't really understand how to maintain muscle strength or the joint stability or the joint mobility as well, the motion of the joints, so that this problem isn't recurring every month or every few months. So these root problems need to be addressed. Hey, I know I'm in your ears right now, you're listening to this right now, and but if you're thinking about getting some more helpful tips for sciatica specifically, let me give you a few resources that you can get to. So if you go to our website at epmanualpt.com, and on the right upper corner, there's a little magnifying glass. Just click on the magnifying glass, type in sciatica, and hit enter. All our web pages, all our blogs that have any sciatica information will pop up, and you can find tons of exercises in there, tons of stretches, home remedies, and what to do and what not to do when it comes to sciatica. And you can begin to try that on your own at home. Now, another thing that we have on our website, we just go to our homepage, epmanualpt.com. Scroll down a bit and you'll see an orange book cover that's all about sciatica tips. You can get that book sent to you directly in a PDF format. Just click on the link near the book and leave us your details, and we'll email it to you instantly. You just check your email inbox, and if it's not there within a minute, check your spam folder. Sometimes it ends up there. And that way you can get the free resources that we have for sciatica. Now, my number one recommendation, though, is that you get specialist expert help for your sciatica and or piriformis syndrome problem. Get with a manual therapist. That's my biased opinion, is go see a manual physical therapist who knows how to handle sciatica problems and pelvis problems at the root level. They know how to free up those lower back joints. They know how to mess with the pelvis joints to make sure that it's the way it's supposed to be, and they'll be able to guide you very well on how to correct the muscle imbalances so that this problem isn't coming back, so that you can avoid ever seeing a surgeon, avoid injections and medications, and remain active and healthy and mobile in your body. That by far is the quickest route to getting healthy again, so that you're able to stand as long as you want, walk as long as you want, sit as long as you want. Oh my gosh, can't tell you how many piriformis and sciatica patients come in and say they took a long drive, they took a little road trip, and it was just killing them. They were miserable. They had to pull over at a gas station and buy some pain medication because it just was so uncomfortable to sit in the car for that long. Their sciatica was going off, and they're having to try to figure out how to do some exercises in the car, and it's just a miserable situation. So I don't want you to end up like that. Get this problem fixed as fast as possible. If you can get to a manual therapist in your area, if you want to consider coming out to us, you can do that as well. Well, thanks so much for listening to our podcast, guys. I appreciate the listen so much. If you can do me a huge favor, and whatever podcast platform you're listening to this on, give us a 5-star review. Go to where you can review the podcast, put 5 stars on there, and type a little blurb out. A paragraph or two would be even better, just explaining how this was helpful for you or commenting on what you liked. What that does for us is it boosts our ratings and our visibility as a podcast to potential listeners. I just care about getting this helpful information out to people. There's so many people that come in for sciatica problems here in the clinic, and they're like, I already got treatment for this, and I saw the doctor, and I saw this person, or I've been doing stuff of my own, and I wish I would have been guided a little better or had some more specialist attention, but all they did for me was pills and injections, or they sent me for an MRI, didn't really go anywhere. The problem went away for a little bit, but then came back. And really, we're solving this problem for people, like for good. They know how to handle it on their own after they're done with treatment here with us. So I hope to get our information out for that reason, because I hate people. I hate when people are suffering way longer than they should, when they're taking pain medications for longer than they should. I'm just worried sick that they're making their organs worse, or their ligaments and tendons worse with those injections as well. So please give us a review. And if you're thinking about working with us, if you want to entertain that idea, give us a call at 915-503-1314. It doesn't hurt to just talk with my staff about what's going on with your sciatica or your piriformis problem, and see if it's right for you to work with us. You can also go to our website at epmanualpt.com and hit the cost and availability tab at the top so that you can see about what it's like to work with us. Leave us your details on that form that pops up on that page, and my staff will call you back as fast as they can to discuss about your issue. They want to hear about your problem and make sure that it's the right type that we can handle here, so that we don't waste your time. And if it is the right type, they'll let you know on what steps to take next on beginning to work with us. Thanks so much for listening, guys. I hope you have a wonderful day. Bye-bye.
Thank you so much for listening to the Stay Healthy El Paso podcast, brought to you by El Paso Manual Physical Therapy, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. If you'd like to learn more about what El Paso Manual Physical Therapy can do for you, call 915-503-1314 or visit our website at epmanualphysicaltherapy.com. Mention this podcast for a free discovery visit valued at $100. If you enjoyed what you've heard, please be sure to leave a review on iTunes and follow the show on your favorite listening platform so you won't miss an upcoming episode. Tune in next time to get the best health tips from experts in the El Paso area.